This is the transcultural nursing presentation for Nursing 480, Dr. Gaza's class. What every healthcare worker should know about patients from India and how to provide culturally competent care across the lifespan. India. First of all, where are these people coming from and what kind of background do they come from? The population of India is approximately 1,282,390,303, which is approximately 17.51% of the current world population. India is rich in culture and has many ethnicities, religions, and languages, but for this specific assignment, we're just going to talk about Hinduism. And most of all people from India, 84% in fact, practice Hinduism. Some interesting, quick, fun facts about India. India is the largest democracy in the world and the seventh largest country in the world. India's Hindu calendar has 6 seasons: spring, summer, monsoon, autumn, winter, and pre-vernal. It is illegal to take Indian currency out of India, and breathing the air in Mumbai, India, for just one day is the equivalent of smoking 100 cigarettes. India has the world's lowest meat consumption. India has more mobile phones than toilets. In West Bengal, India, cows must have a photo ID card. One woman dies every hour in India due to dowry-related crimes, and 70% of all the world's spices come from India. 53% of homes in India do not have a lavatory. India is home to the world's most polluted city, which is New Delhi. Gleevec, a cancer drug that costs the US $70,000 per year, costs just $2,500 in India because the drug cannot be patented. Between 100,000 and 500,000 abortions are still performed in India because the fetus is female and male is the preferred sex in India. India values beliefs regarding health care. Most Hindu practicing Indians believe in reincarnation. They believe that one has many lifetimes and each current and subsequent lifetime is based on their past. Hindus believe that the most successful attainment of the ultimate better life is through moksha, or liberation. As a whole, the Hindu religion is a very liberal religion, allowing people the freedom to practice however they would like. Prayers and meditation are very important and can occur anytime and anywhere. Hindus use a variety of Ayurvedic medications, which include home remedies, spiritual remedies, and Western medicine. Modesty is very important to Hindu people, and both men and women prefer practitioners of the same gender. Hygiene is very important to Hindu people. Therefore, if they're bedridden, it would be important for a small basin of water to be placed at the bedside at all times to keep the hands clean. Oral hygiene is very important to Hindus. Hindus believe that brushing their teeth in the morning washes away any impurities that have built up in the mouth overnight. And for this reason, when a patient wakes from general anesthesia, he or she may ask to brush their teeth immediately. Women may be less forthcoming regarding their sexual or physical health, especially if they are being cared for by a male practitioner. When babies are born, the father may want to touch, smell the infant and whisper prayers into the child's ears. A family member may want to place an Om symbol behind the infant's ear and on the infant's tongue with honey. It is interesting to note and very important to stress to Hindu families that in America we do not, the American Academy of Pediatrics does not recommend giving honey to infants under the age of 12 months. A naming ceremony occurs when the child returns from home and the umbilical cord is buried in the backyard 6 days after birth. Now, in the case that a patient is in the hospital, a baby's in the hospital for longer than 6 days, that is okay. It will take place when they come home. Children ages 0 to 17, as with women, when examination takes place for children, it's important to consider that Hindu people value modesty and prefer same-sex practitioners. A combination of Western medicine and herbal medicines are used to treat children. So it's not uncommon for children to show up at the doctor's office and have been given herbal medications. Circumcision is not usual in Hindu children, and this stems from the thought that an uncircumcised male is less likely to acquire diseases such as HIV and transmit them. Adults ages 18 to 64 years. Again, modesty continues as a consideration. Same-sex practitioners should be considered. Again, both herbal and Western medicine are used for healing. And we must not place a stigma on patients that do not seek immediate care for illness, as most of the time they will seek religious and herbal healing before Western medicine. Many Hindu patients are vegetarian and will not accept medications made with animal byproducts. And the right hand is clean and used for clean tasks such as eating and shaking hands. The left hand is not clean. Older adults 65 years plus. Hinduism believes and supports an organ and tissue believes and supports an organ and tissue donation. And like Americans, they leave this decision up to the individual. Mental illness such as depression is looked upon negatively, and therefore patients generally will not seek care for that because they're afraid of stigma. Hindus encourage the acceptance of pain medicine and believe that pain is the consequence of karma from the past life, from negative behavior that they may have suffered. They don't believe it's punishment. They just believe that it's just part of life, just something that happens. Hindu persons prefer to die at home. However, in the event that they die in the facility, it's very important to leave all religious symbols on the body and allow the family to prepare the body and accompany them to the mortuary. In the Hindu community, marriage is sacred and thought to be not only a lifetime commitment, but a commitment for up to 7 lifetimes. Hindus believe in not one, but many supreme gods. They are still organized by a caste system, which is controversial in the Hindu community. They believe in reincarnation of the soul and that your current life is directly affected by your past life and future lives. Sex before or outside of marriage is frowned upon, and family is very important in the Hindu faith. It is not unusual for grandparents, uncles, aunts, and others to live in the same household. I hope you enjoyed this presentation on the Hindu faith and religion. It was very difficult to get a lot of information on this important topic. However, this is something that I deal with on a daily basis with my job at WakeMed, as we take care of a large population of Hindu, Indian people. So this project was very near and dear to my heart. I hope you enjoyed it. Have a good evening.